Okay, so next question was how many hours should a 3-year-old who is nonverbal get? Our ABA person is saying 10 hours is enough. And of course, that sets off every warning bell I have in the world. So, a 3-year-old who's nonverbal, how many hours? And it's individual, right? But as a guideline, 10 makes me close to hysterical.
I would agree with you. You're exactly right. It is individual. The number of hours that we need to provide for a child depends on what his or her own needs are. But there are these general rules, these things that we have found either through research um, or no, what we found through the research, through the data, is that at that age, at 3 years old, particularly when you have a child who is nonverbal, we're probably looking at more like 40 hours a week. Sometimes we might even be looking at more. The best indicator of a good prognosis for a child, the one thing that we can control the best that makes the biggest difference, is the intensity of of the therapy, of what the dosage is, you could say. And 40 hours a week, it is an intense program for sure. And I think many parents are concerned about that because they're thinking he's 3, why is he working a full-time job? But that's not really what it is. It's more like he has a medical need. Why would we not want to give them the correct dosage to treat that?
Yeah.
We have had an interesting dynamic here in the Northwest where for a long time there were a lot of recommendations for 4 hours a week or 6 hours a week or this kind of thing. I know that you've had Vince Redmond on as a regular guest, and he's talked about this a few times, at least with those of us here in the Northwest. And when CARD came in and was saying, no, what the research shows is that we need to be looking at 30 hours, 40 hours, whatever it is, a lot of families were shocked by this. But I think that the results speak for themselves.
Yeah.
I think that what we found is that 40 hours a week, when a kiddo is 3, especially if they're nonverbal, especially if they lack that most vital skill set, we need to be getting down. We need to be pushing hard to get them caught up.
Absolutely. It makes me mad for parents when they find out that people they trusted were telling them that 4 hours a week was reasonable. There is no study that showed, no, zero studies that show that that's effective. In fact, there is a study that showed kids who were getting 10 hours a week and kids who were getting 25 to 40 hours a week, and it showed that the 10 hours was not effective. 10 hours was not enough to make a difference. We all understand intensity. It's the difference of if you go to the gym once a week or if you go to the gym every day for 6 hours. How different you will look in 6 weeks will be vastly, vastly different. And when we have a kiddo who is nonverbal, as you were saying, Nate, we want to give them their best opportunity. And so we look at the science and it says that kiddo should be more in the window of at least 30 to 40 hours. And we've had Dr. Granpeche on the show before who says, that's how much you're going to get funding for, but that every waking hour needs to be an educational opportunity for that child so that they have the best chance of making the most progress. So it makes me mad, though, when I hear that people who know better, who have access to studies, are saying to parents who wouldn't know 4 hours. Because to me, that is just a funding thing. That is trying to give your child watered down. I mean, if somebody handed you a prescription for penicillin and you know that you got to take one pill every day for 10 days and they said, no, just take it for 2 days, you would know that they were trying to cheat you out of what we know to be effective. And so to me, that's personal. If somebody is telling you that 10 hours is enough, I wouldn't trust that person. Just